Do you realize how easy it is to find heroin on the streets? The Centers for Disease Control has stated that our nation has started what has become the heroin epidemic, also known as the quiet epidemic. For some background information, heroin, also known as black tar, big H dog, horse, and puppy chow, is derived from the opiate morphine. This drug can be injected, smoked, inhaled, or snorted. Nationwide, heroin use has increased 100% among females, 70% among middle and upper class, and 109% among the 18 to 25-year-old population. Wake County, North Carolina has seen a 400% increase in the use of heroin within the last 5 years. North Carolina has seen a 547% increase in heroin deaths from the years 2010 to 2014. Drug overdoses have become an overwhelming problem locally and nationally. The problem usually begins with a legal substance when prescribed, used for pain management, opiates such as Oxycontin. Statistics show that 80% of heroin users start from pills. The Centers for Disease Control also shows that nearly all people who used heroin also used at least one other drug. This heroin epidemic is a chronic relapsing condition. The drug is cheap, available, and the purity of the drug is better, and people enjoy that quick high. Heroin does not discriminate in that there are no boundaries when it comes to the target population. This drug has become popular to women, men, legislators, police officers, healthcare workers, people of any race and income status, and many more. So what is causing this increase in heroin users and overdoses? Data has shown that there are a lack of resources, education, funding, and treatment facilities. This has become a public health issue, not an incarceration concern. Arresting these individuals is not going to solve the overall problem. Individuals need help with treatment and education to significantly reduce these statistics. Where can we start to make the change that is needed? Healthy People 2020 objectives place a strong emphasis on education at the earliest ages to support prevention efforts and maintain cost containment in the future. With drug use, specifically heroin, becoming so popular, major emphasis needs to be put on primary prevention. It is important that we focus on the youth population and start educating them early in school. Identification and modification of risk and protective factors that apply to drug use is extremely important. Educating children early and introducing them to what drugs are and the effects of them should help decrease the drug use in the population. Secondary interventions such as early diagnosis and treatment of addictions are crucial. Treatment programs offer a comprehensive approach as well as screening and detection. With tertiary prevention, ongoing follow-up and treatment such as 12-step programs and self-help groups to prevent relapses to help maintain recovery is key. This is a chronic condition that needs ongoing treatment. Governor McCrory has already begun taking steps to improve this epidemic. He has increased funding for medicated assistant treatment programs and other preventative measures. On June 20, 2016, he signed a law where pharmacists can dispense Narcan for individuals who meet the criteria for the standing order. Narcan is the antidote for opiates and can reverse the side effects in minutes. So far, 2,500 lives have been saved in North Carolina from using Narcan. Other ideas that have been reviewed are North Carolina drug diversion programs, needle exchange programs, safe injection facilities, as well as methadone and Suboxone clinics. Currently in North Carolina, syringe exchange programs are prohibited. North Carolina is currently in the process to change this. Ethical issues and concerns could arise from a needle exchange program and safe facilities for people to inject, in that it seems that we would be encouraging drug use and crime rates. The World Health Organization and other studies have shown that the individuals who use needle exchange programs are actually 5 times more likely to enter drug treatment centers than non-users. Some of the local public health services located in Wake County, North Carolina are the Healing Place, South Light, Healing Transitions, Holly Hill Psychiatric Hospital, Capital Area Narcotics Anonymous, and the Raleigh Methadone Treatment Center. There are also residential, inpatient, long-term, and outpatient facilities offered to help individuals with their drug abuse and recovery. Wake County is already taking the initiative to cure this epidemic and to make Wake County, as well as North Carolina, healthier as a whole. Wake County Human Services has established a coalition of community partners, including law enforcement, hospitals, emergency medical services, the North Carolina Harm Reduction Coalition, the Medical Examiner, behavioral health providers, Community Care of Wake County, and the Wake County Board of Commissioners. As of 2015, the coalition has agreed to discuss the following 6 topics: syringe exchange programs, education and outreach, access to substance abuse treatment and other resources, medical intelligence, Narcan distribution, and lastly, policy, law enforcement, and diversion change. I want to end with a quote from an anonymous heroin user. "I am a drug addict. I suffer with a disease called addiction. I can't be cured, but I have learned to live with it. I will be in recovery for the rest of my days. Today, I'm grateful to be alive and drug-free." With increased awareness, education, and treatment facilities, we can be the change that helps save lives.